What if I told you that the answer to maintaining your sexual vitality after 50 isn't found in expensive prescriptions or complicated medical procedures? What if the solution costs less than your morning coffee and is available at any pharmacy without a prescription? The truth is, 3 specific vitamins, overlooked by most doctors, could be the difference between a declining intimate life and maintaining the confidence and performance you deserve. Today I'm sharing the scientific evidence behind these 3 affordable nutrients that could transform your bedroom experience within weeks. This information is being suppressed, but not anymore. Welcome to another video. I'm Dr. Grace Hill. If you're looking for reliable, no-nonsense solutions to regain your potency and confidence, subscribe to this channel right now so you never miss any content that could change your intimate life forever. Today we're discussing something that could revolutionize your approach to sexual health after 50. 3 affordable vitamins that address the root causes of declining performance. The conversation about male sexual health after 50 is plagued with misconceptions and half-truths. Your doctor might tell you that declining performance is simply an inevitable part of aging, something you should accept with quiet resignation. This couldn't be further from the truth. What most healthcare providers won't explain is that many issues with erectile function, stamina, and sexual desire after 50 aren't actually age-related at all. They're nutritional deficiencies masquerading as age-related decline. Your body requires specific nutrients to maintain healthy blood flow, hormone production, and nerve sensitivity, all critical elements for satisfying sexual function. The medical establishment often jumps to pharmaceutical solutions because they're profitable and quick. But addressing the underlying nutritional deficiencies is often more effective and certainly more sustainable for long-term sexual health. Research from the Journal of Sexual Medicine shows that men who correct specific vitamin deficiencies experience improvement in erectile function comparable to popular prescription medications, without the side effects or dependency. Yet this approach rarely makes headlines because there's little profit in promoting affordable supplements. The most concerning aspect is that standard blood tests often miss these critical deficiencies. The reference ranges used by most laboratories are designed to identify disease states, not optimal levels for sexual function. You can be told your levels are normal, while still suffering from insufficient nutrients for peak performance. Today, we're cutting through the misinformation to reveal the 3 most powerful, yet affordable vitamins that directly impact your ability to maintain a satisfying intimate life well into your 70s and beyond. The connection between specific vitamin deficiencies and erectile dysfunction is one of medicine's most underappreciated relationships. To understand why these nutrients are so critical, we need to examine what actually happens during an erection. Sexual arousal triggers the release of nitric oxide in the erectile tissue, which signals blood vessels to dilate, allowing blood to flow into the penis. Simultaneously, smooth muscle tissue relaxes, trapping the blood and creating firmness. This complex cascade requires specific nutrients at each step, nutrients that become increasingly depleted as you age. Multiple studies have shown that vitamin deficiencies directly impair this process in several ways. First, they reduce nitric oxide production, limiting the initial vasodilation signal. Second, they impair the endothelial function, the inner lining of blood vessels that must respond appropriately to these signals. Finally, they can reduce testosterone levels, diminishing both desire and the ability to achieve and maintain erections. What few men realize is that the early warning signs of these deficiencies often appear years before erectile dysfunction becomes evident. Fatigue, muscle weakness, decreased exercise recovery, and even mood changes can all signal the nutritional insufficiencies that will eventually affect sexual function. The good news is that these deficiencies can be corrected quickly and inexpensively, often with noticeable improvements in sexual function within just a few weeks. And unlike pharmaceutical approaches, addressing the underlying nutritional causes creates sustainable improvement without dependency or escalating side effects. Let's examine the first critical vitamin that directly impacts blood flow to the genital region. The first vital nutrient is vitamin D3, often called the sunshine vitamin. While most associate vitamin D with bone health, its role in sexual function is equally important, yet rarely discussed in medical settings. Vitamin D3 acts more like a hormone than a vitamin in your body, directly influencing over 3,000 genetic pathways, including those controlling blood vessel health and testosterone production. Research published in the International Journal of Endocrinology demonstrated that men with vitamin D deficiency had a 70% higher risk of erectile dysfunction compared to those with optimal levels. What makes this vitamin especially important for men over 50 is its direct impact on endothelial function, the critical ability of blood vessels to dilate in response to arousal. As you age, endothelial function naturally declines, but vitamin D deficiency accelerates this process dramatically. Even more significant is vitamin D's role in testosterone production. A groundbreaking study in the journal Hormone and Metabolic Research found that men who corrected their vitamin D deficiency saw an average increase in testosterone levels of 20% over just 12 months without any other interventions. The most compelling aspect is how affordable this supplement is. A 3-month supply of high-quality vitamin D3 costs less than $20. Pennies per day for potentially transformative benefits to your intimate health. The optimal dose for men over 50 is typically between 3,000 to 5,000 international units daily, though individual needs vary based on factors like sun exposure, body weight, and existing health conditions. Most importantly, this supplement should be taken with a meal containing some fat, as vitamin D is fat-soluble and requires dietary fat for proper absorption. You might wonder why vitamin D deficiency is so prevalent, affecting 78% of men over 50, according to recent epidemiological studies. The answer involves several factors unique to modern life and aging. First, your skin's ability to produce vitamin D from sunlight decreases by up to 70% between the ages of 20 and 70. Even if you spend the same amount of time outdoors as you did in your youth, you're producing significantly less of this vital nutrient. Second, the modern indoor lifestyle severely limits sun exposure. Most men over 50 spend less than 15 minutes per day in direct sunlight without sunscreen, far below the threshold needed for adequate vitamin D production. Third, medications commonly prescribed after 50, particularly statins, blood pressure medications, and acid reducers, can interfere with vitamin D absorption and metabolism. Many men taking these medications develop deficiencies even with adequate sun exposure and dietary intake. Perhaps most concerning is how standard blood tests often miss this deficiency. Most laboratories define vitamin D deficiency as levels below 30 nanograms per milliliter. However, research focused specifically on sexual function suggests that levels below 40 nanograms per milliliter are insufficient for optimal erectile function and testosterone production. This means millions of men are told their vitamin D levels are normal while still experiencing levels too low for sexual health. Correcting this single deficiency has been shown to improve erectile function in up to 60% of men who previously showed no response to conventional treatments. The solution is straightforward: regular supplementation with vitamin D3, periodic blood testing to confirm optimal levels, and minor lifestyle adjustments to improve natural production through safe sun exposure. Before we move on to the next vital nutrient, I want to share something important for men who need that extra support. I'll recommend 2 revolutionary supplements for better erections, healthy testosterone support, and prostate comfort, ones I trust with my patients. Check out the reviews below for the exact products and links if you'd like to consider them. The second critical nutrient for male sexual health after 50 is vitamin B12, a water-soluble vitamin that plays an essential role in energy production, nerve function, and hormone regulation. While not directly involved in testosterone production like vitamin D, B12's impact on sexual health operates through several crucial pathways. First, B12 is essential for methylation, a biochemical process that occurs billions of times per second in your body and directly affects energy production at the cellular level. Proper methylation is critical for the health of your circulatory system, particularly the small blood vessels that control erectile function. Second, B12 deficiency leads to reduced oxygen transport through the bloodstream. Erectile tissue requires significant oxygen delivery to function properly during arousal. Without adequate B12, this oxygen transport becomes compromised, leading to weaker and less sustainable erections. Third, and perhaps most significant, is B12's role in neurological function. As you age, nerve sensitivity naturally decreases, including in the genital region. B12 deficiency accelerates this decline, reducing both the physical sensation and the neural signaling necessary for initiating and maintaining erections. What makes B12 particularly relevant for men over 50 is that absorption naturally decreases with age. Even with adequate dietary intake, many men develop functional B12 deficiency because their digestive systems can no longer efficiently extract this nutrient from food. Studies show that up to 30% of men over 50 have suboptimal B12 levels, despite consuming adequate amounts in their diet. The good news is that supplemental B12, particularly in its methylcobalamin form, bypasses these digestive limitations. The cost is minimal, typically less than $15 for a 3-month supply, making it one of the most cost-effective approaches to supporting sexual health. Now that we've covered 2 critical vitamins, let's discuss how to optimize their absorption for maximum benefit. The timing, combination, and method of taking these supplements can dramatically affect their impact on your sexual health. The ideal protocol begins first thing in the morning. Take your vitamin D3 with breakfast, ensuring the meal contains some healthy fats like avocado, eggs, or olive oil to enhance absorption. Since vitamin D is fat-soluble, taking it without dietary fat can reduce absorption by up to 70%. For vitamin B12, sublingual tablets or liquid drops are vastly superior to standard pills, particularly for men over 50. These forms bypass the digestive system, where absorption issues commonly occur, and enter the bloodstream directly through the tissues under your tongue. Timing these supplements with physical activity further enhances their effectiveness. Research shows that taking these vitamins approximately 30 minutes before morning exercise increases their utilization by the body. The increased circulation during physical activity helps deliver these nutrients to the tissues that need them most, including the genital region. Hydration plays a crucial role as well. Many men over 50 are chronically dehydrated, which impairs nutrient transport throughout the body. Drinking 16 ounces of water when taking your morning vitamins ensures optimal circulation and delivery. Perhaps most importantly, consistency matters more than dose. A moderate daily supplementation routine maintains stable levels in your system, allowing for ongoing repair and regeneration of the vascular and nervous tissues essential for sexual function. The full benefits typically emerge after 4 to 6 weeks of consistent implementation, though many men report noticeable improvements in energy and morning erections within the first 2 weeks. The third essential nutrient for maintaining sexual vitality after 50 is vitamin K2, specifically in its MK7 form. This overlooked vitamin works synergistically with vitamin D to regulate calcium in your body, with profound implications for vascular health and erectile function. What makes K2 particularly valuable for sexual health is its role in preventing arterial calcification, essentially keeping calcium out of your arteries and directing it to your bones where it belongs. This is crucial because arterial calcification is a primary contributor to reduced blood flow, especially in the small vessels that control erectile function. Research published in the Journal of Cardiovascular Pharmacology demonstrated that adequate K2 levels reduced arterial stiffness by up to 20% in adult men. This increased vascular flexibility directly translates to improved blood flow to the genital region during arousal. Beyond its vascular benefits, K2 also supports testosterone production through its regulation of vitamin D metabolism. The two vitamins work together. D3 initiates testosterone production, while K2 optimizes D3 utilization, creating a synergistic effect greater than either nutrient alone. Most compelling is a study from Eastern European researchers that found men supplementing with both D3 and K2 experienced up to 40% greater improvement in erectile function compared to those taking D3 alone. The combination appears to address both the hormonal and vascular aspects of sexual function simultaneously. Despite these powerful benefits, K2 remains surprisingly affordable, typically costing between $15 and $25 for a 3-month supply. The optimal dose for men over 50 is around 100 to 200 micrograms daily of the MK7 form, which has superior bioavailability and half-life compared to other forms of vitamin K. Like vitamin D, this supplement should be taken with a meal containing some healthy fat to maximize absorption and utilization by your body. While the 3 vitamins we've discussed can dramatically improve sexual function, certain supplement combinations can actually worsen performance or create health risks, particularly for men over 50. Understanding these dangerous interactions is just as important as knowing which supplements to take. First, never combine these vitamins with high-dose niacin supplements unless under medical supervision. While niacin, vitamin B3, in moderate doses can improve cholesterol profiles, high doses taken alongside vitamin K2 can cause excessive blood thinning in some men, especially those already taking medications like aspirin or prescription blood thinners. Second, be cautious with iron supplements. Many men incorrectly assume that more iron means better energy and performance. However, excess iron accumulation is common in men over 50 and can directly interfere with vitamin E metabolism, creating oxidative stress in the vascular system, exactly what we're trying to prevent for optimal sexual function. Third, avoid megadoses of calcium when implementing this protocol. The average multivitamin contains adequate calcium, and additional supplementation can counteract the vascular benefits of vitamin K2, potentially leading to calcium deposition in arterial tissues rather than bone. Perhaps most important is the timing relative to medications. These vitamins should be taken at least 2 hours apart from common prescriptions like blood pressure medications, cholesterol-lowering drugs, or acid reducers. Taking them simultaneously can reduce absorption or create unexpected interactions. One particularly dangerous combination is high-dose vitamin D with certain blood pressure medications, which can cause unexpected drops in blood pressure. While the doses recommended in this protocol are safe for most men, always consult with a healthcare provider if you're on multiple prescriptions. The safest approach is a methodical one. Introduce these supplements one at a time, with at least a week between additions, allowing you to identify exactly how each affects your body before adding the next. Your body often signals vitamin deficiencies long before sexual dysfunction becomes apparent. Recognizing these early warning signs allows you to address nutritional gaps before they impact your intimate life. Here are the 5 most common indicators that you may be deficient in these critical vitamins. The first sign is unexplained fatigue, particularly in the afternoon. While many men attribute this to age or stress, it's often one of the earliest symptoms of B12 and vitamin D deficiency. If you find yourself consistently losing energy around midday, despite adequate sleep, your body may be signaling these nutritional gaps. The second warning sign is muscle recovery issues. When the small tears that occurred during normal daily activities take longer to heal, causing prolonged soreness or weakness, it often indicates insufficient vitamin D. This same delayed recovery process happens in vascular tissue, including erectile tissue, though you may notice the muscle symptoms first. Third, pay attention to mood changes, particularly increased irritability or unexplained low mood. The neurological effects of B12 deficiency often manifest as cognitive and emotional changes before physical symptoms appear. These mood alterations correlate strongly with declining testosterone levels, which affect both brain function and sexual performance. The fourth sign involves temperature sensitivity, particularly in the extremities. If your hands and feet seem colder than they used to be, or if you've become increasingly sensitive to cold temperatures, this often indicates circulatory changes related to vitamin K2 and D3 deficiencies, affecting blood vessel function throughout your body. Finally, watch for changes in sleep quality, especially difficulty maintaining deep sleep. Vitamin D plays a crucial role in sleep architecture, and deficiency commonly disrupts the deep sleep phases necessary for testosterone production. This creates a damaging cycle. Poor sleep reduces testosterone, which further impairs sleep quality and sexual function. If you're experiencing 2 or more of these warning signs, your body is likely already developing the deficiencies that will eventually impact sexual performance. Addressing these nutritional gaps proactively can prevent intimate issues before they develop, rather than trying to reverse them after they've become established. If you found this information valuable, take a moment to like this video and subscribe to the channel. The 3 affordable vitamins I've shared today, D3, B12, and K2, could transform your intimate health without expensive prescriptions or embarrassing doctor visits. Click right now on the video appearing on your screen and continue this journey to regain confidence, pleasure, and intimate health at any age. Remember, maintaining your sexual vitality isn't about age, it's about giving your body the specific nutrients it needs to perform at its best.